Hi, this is Dan Praz live from the Underground Radio Network with part 2 of Obamacare. I am a CEO. I've read the entire law, and my staff wanted me to bring these presentations to you to tell you what's actually in the law. And to tell you the truth, I'm a master salesman, and I knew the moment I heard all the details of the healthcare plan that this was some kind of scam. They're trying to sell you a bill of goods that just isn't any good. And basically, it's kind of like a magic trick. And what they do is they hold the magic trick over here, which is affordable patient care, everybody covered. And see, you keep your eye there, then over on this side is where all the fun takes place. All the bad stuff, out of sight, things that you don't realize. Now, don't take my word for it. That's the first thing I'm going to tell you. I have the actual bill will be up on the website. It's debtorsrebellion.com. You go to the website, pull the bill off. I'm going to tell you the page numbers. I'm going to tell you what it says, and you can make up your own mind. You don't have to take my word for it. Now, before I tell you the real scam and how it all works, let me give you a little business background. Last year, I'm in the franchising business. Franchising overall, in the worst economy since the Great Depression, franchising actually rose their bottom line 1%. And this is what Congress doesn't understand. Most people in Congress do not understand business. They do not understand that businesses are not going to simply stand there and take whatever is dished out to them. What they're going to do is they're going to react. And most of the times they react by keeping the bottom line the same and cutting jobs. And that's what they do. So franchising lost 4% of jobs in 2009. Franchising shed 4% of jobs, but still maintained a 1% increase in the bottom line. Now, before you say I'm the mean, vicious business owner, the mean, vicious CEO, I have to tell you, no CEO wants to cut jobs. It's the worst possible thing that we can do. It's a terrible thing to do. And so if you lost your job in this downturn, we understand how terrible that is. But there is a reality to it. The 4% that got cut saved the other jobs, the 96% of jobs. Now, let me explain that a little bit further. Businesses aren't like the federal government. We can't simply just print more money. We can't simply go into debt. We can't simply have a deficit. If we do that, we go out of business. And so we have no choice. But the bottom line will remain. Now, that's important when I get to the healthcare issue. Let me give you a quick example. This is the congressman that represents my district, the 7th Congressional District of Pennsylvania, is Joe Sistak. And Joe was a career Navy guy. He was 31 years, and God bless him, he did a great job. He became an admiral, 31 years serving the Navy, and then 2 terms now as a congressman. But there's an important thing here that the congressman doesn't understand. He's never had a payroll. He's never had to pay anybody. He's never had to provide health insurance for anybody. So here's the congressman representing me in this matter. And he also telling me what I need to do for my business and my employees when he's never done it himself. And I find that's pretty amazing. I don't know where he gets the information to say this. Now, he's one of just 219 in the House to sign for this. 219 people in the House, 60 in the Senate, and the President of the United States. 280 people made a decision that will affect more than 300 million. Now, even if you're for the health care bill, it's still 280 people representing 40 million that don't have health insurance. That's an awful lot. I think something this widespread should be 2/3 majority. Anyway, the congressman sent me an email to talk about the great positive changes that would come my way. You see, I pay 100% of my staff's health insurance. I pay for their full medical, their dental, and vision. 100%. I pay for it out of my pocket. Okay? Now let me read you what the congressman says is going to happen. And this is the changes he said are coming my way. And this is a quote right from an email from him. He's going to require insurers to cover a minimum set of benefits and a minimum portion of the individual's health. That's a requirement from insurers. Requires insurers to cover young adults on our plans. Prevents insurers from taking away coverage. Prevents insurers from discriminating due to pre-existing conditions. Prevents insurers from discriminating due to age or gender. Prevents insurers from lifetime caps. And prevents insurers from annual caps on coverage. Now that's with 3590. The new healthcare law is done. But let me tell you something. It sounds really good, doesn't it? It sounds warm and fuzzy, and it sounds like something that we all should be for, right? Let's get those nasty insurers. The insurance companies. It's the private insurance. Now, the truth is, this isn't going to affect a single person that doesn't have insurance. All those things I just read, are not going to affect a single person who does not have insurance. It's going to affect those with private health insurance, like what I provide for my company. So what's going to happen, and you can make the decision, and you decide. Just as like I told you what happened in the recession, businesses cut jobs. There's only two ways for businesses to respond. They either cut expenses, which most of the time is jobs, because that's the most expensive thing for a business, okay? Or they're going to raise prices. One or the other. They're not going to sit there and have all of those mandates that they have to pay for and just pay them and be happy. They're going to pass those on to me. So much for affordable health care for me. So, the moment I heard these things, way before the bill was law, I knew what the scam was. I knew what the fix was. I know my rates are going to go up for my private health insurance. There's no doubt. It is impossible to take all of the fringe high-risk elements and make them mandatory in an insurance policy and not have the premiums go up. I know this as a business owner because I have multiple insurance coverages. I know my premiums will go up. And that's all part of the scam. So I went to a town hall meeting and I face-to-face asked Congressman Sistak, I said, to point out in the bill for me exactly, specifically, how it's going to lower my health care costs for my employees for my private insurance. And he couldn't answer. Of course, he started giving the big political speech and walking around it. And the very last thing he said is, well, you can always go into an exchange. And there it is. That's the magic trick. See? They get me carrying, looking over here, and the dirty trick's going on over here. And that's the deal. So let me explain it to you how it's all going to work out.